Hello and welcome back to the movement with Dr. Sandhya Ravi. And as you already knows my name, I don't need to tell it again. So today's episode is all about healing beyond the conventional. So we are dividing into a powerful conversation with a pioneer in integrative physiotherapy. Co- The person name is Dr. Srinivas, founder of Swecha Physiotherapy Centre. With nearly 2 decades of clinical wisdom, he brings a refreshing perspective of patient care, one that blends science and soul, tradition and therapy. So, from his unique work in orthopedics and sports and the role of holistic healing, get ready to rethink what movement medicine can truly be. Okay, and let's get moving. And I'm going to call Dr. Srinivas to come to the stage. You can unmute. Yeah. Welcome to the show, The Moment with Dr. Sandhya Ravi, because this show is all about not just movement in our life, like walking, running, like that. So, movement is there in everything. Movement is there in our life. Movement is there in the nature. Movement is there in business. Movement is there in relationship. So, that's the reason we take experts who are in the movement, not only telling there is a movement, they're also doing the movement in life, in business, and everything. And I'm super duper happy in inviting you. And you can tell a briefly about it. It's already I've given an introduction. If something I missed, which I'm not aware, I'm happy to hear it from you.
Yeah, you mentioned everything correctly only. So
Yeah.
apart from physiotherapy, I am the specialized in bodyweight trainings also.
Okay. Yeah. That is super amazing. Yeah. Is there anything else you want to tell to our viewers or something, or else I can start with the questions?
Okay. Yeah. Thank you, Dr. Sandhya Ravi, for selecting me as a host, not host, sorry, taking the interview with me. Thank you.
Guest. Guest. Yeah. Fine. Thank you so much. Thank you so much for coming and giving me the appointment to do the session. So first, I want to ask the question as like, what inspired or what made you to pick physiotherapy as your
Okay.
studies or as a
Fine. Yes.
profession?
I don't know about anything about physiotherapy, but
Yeah.
after my 10 plus 2, which I did from Navodaya school. So Navodaya school is meant for combination of all the activities, especially sports related activities. So after coming out of this Navodaya, then I search for the few places where I continue, want to do something different. Then regular courses. So in that I found that it's a physiotherapy. So I asked my seniors, what is physiotherapy? Then they told me that it's a complete, curing of disease with a physical mean. Then in the nowadays I used to do a lot of physical activities. Then I thought that yes, this could be it's matched with my mentality. Then I have decided to do some physiotherapy because it's matching with my mentality. And
Mm.
moreover, uh, uh, the curing is with a physical way without medication. So that's connected with my mind. So then I immediately yes, I want to do this course. So I fixed to do this course anyway. In that way, I continue as a physiotherapist.
Okay. How many years you're practicing physiotherapy? That's
Last around 18 years, I'm practicing this.
yes. Okay,
18
but
years.
actually, you right now also you look like you're ready to go to the college.
Yes,
How?
okay. I'm 41 now, but because
Okay.
of physical exercise, maybe genes and physical exercise,
Okay.
uh, helping me to look like young.
Yeah, yeah. No, I think so. Then you can start like anti-aging through physiotherapy as a program. Like I think so. A lot of people will be interested to join.
That is we will do in future. So,
Yeah, yeah.
but
Because you are the example.
yeah, yes, but no, people will recognize after 50 because they will think that yes, with the fitness, age will come down. Then, after 50 years, they will recognize that yes, with fitness, age will come down. If I tell
Okay.
now, they may listen, may not listen. But when I reach 50, most people listen.
Okay, fine. Then at 50, you're going to start an anti-aging program, I think
I
so.
can do that one, definitely.
Fine. I'll be the first client to join you for sure. Yeah, I
Thank you.
myself do physiotherapy, but the way you do is something great. And I have super amazing question because I know your business is called Swecha Physiotherapy Center.
Yes,
Am I right?
yes.
Yeah. So I want to know like what led you to start Swecha Physiotherapy Center, and when
Okay.
did you start?
Okay, fine. So before starting Swecha Physiotherapy, I worked as a physiotherapist in one corporate hospital,
Hmm.
uh, where I worked as a 1 year. So in that, I used to do every activity. I mean, everything is related physiotherapy. But here,
Hmm.
I'm not getting any recognition, even though I'm giving the result to the patient. But in corporates, they are not recognizing my talent. And
Hmm.
moreover, I want to develop physiotherapy. So, like, I want to give to the importance of physiotherapy. Even I approached to the HR. So, like, make a one room for separate. Or some, I used to make one awareness program also. But nobody is care to listen my words. At the time of 2007, so they
Okay.
used to be less important. Then I have decided I should not do job because nobody even giving result, nobody is recognizing me. Then at the time when I decided and I will not do job. If I do, I will start my own clinic only. I have decided. So
Okay.
after 2008, I decided so this is not right place. Then I will do some other course so that I will get some knowledge. Then after that, I did one PG course. Then immediately I thought that no, no, after after 1 year job, I did two PG courses. So in that also, I
Okay.
got one campus placement. So in
Hmm.
that campus placement also, they have selected me. But in that, I had told them that I will not do job. I will start my own setup. Then the professor asked me, you don't have any funds. I will start. I will start in my own way with some even like 10,000 also. I will start my own clinic. So in that way, I start my own clinic with a minimum basic amount.
Okay, fine. Yeah, that's great. Starting a physiotherapy center with 10,000 people could never think about. And during that time, and that too, when awareness was very low, when you
Yes,
started back then. Yeah,
yes,
so
yes,
and huge respect and salute to the courage what you had at that time because
yes.
when everyone thinks about job and everyone thinks about okay, all this study right now, it's the time for you to earn. But you don't know what is your future is going to be, and you took the risk because that is an amazing quality of an entrepreneur. Because entrepreneur is someone like the entrepreneur only knows the long term vision. Rest of the people can't understand the way why he takes that risk. Are you happy that you took the risk on that day, or have you ever felt someday like, okay, could I have gone to work instead of starting?
No, no, no. So in fact, it helped him a lot because even professor also didn't think that I will start clinic because came from pure background. So he thought that I will not start my clinic, but I proved him wrong. With the
Hmm.
10,000, not only with the 10,000, within 6 months I opened four branches.
Wow. At present, how
So
many branches you have?
uh,
At present, how many branches you have?
present now only one branch. I will tell you the story behind why one branch again why I was failed in another four branches. So
Sure.
in 6 months, I opened four branches in different locations. I recruited many physios, but nobody is willing to do. The enthusiasm is not there in our physio. So
Got it.
that's where I could not able to manage all the four centers. Everywhere I'm going, but everyone is looking for my services only.
Okay.
Then it's not right way. Then after COVID, so I shut down all the three centers. Then I opened a very big branch. It's in
Hmm.
Hyderabad. It's
Okay.
included with India center.
Fine, fine. That is super amazing. Instead of having four in different location, having one big one is a better choice accordingly. It's easy to manage. That's a great choice.
Yes,
And I want to know like what is the story begin the name Swecha? So like what is all about Swecha?
yes. So before starting clinic, I'm searching for few names.
Okay.
Uh, which name I should keep? So in that, so I found Saukya and Swecha.
Okay.
I mean, while finding two names, Soka and Swecha. But in my dream, the word Swecha came. I don't know why it is came, but it came. But after that, I found the meaning of Swecha. Swecha means freedom. So
Okay.
Swecha means freedom. For me also, I want to live like as a freedom. I don't want to take other opinions. Other attitudes. So I want, and moreover, the person should live in the freedom and without any pain free. Then I
Yeah.
thought that Swecha is the right word for everything. It's a mentally free, physically free. Then Swecha is the right word. Then I kept as a Swecha is a clinic name.
Wow, that is great. Like that is a wonderful name because even I was saying, okay, what is that about Swecha? So like maybe because according to the story, initially I thought maybe name of your kid or like name of your some closed one, something might be Swecha. But right now knowing the meaning, it's something literally amazing. Freedom, because even I love freedom. Yeah, so I can understand that. And you are specialized in ortho and sports, right?
Yes.
Like, what made you to pick ortho and sports? There are so many streams in physiotherapy as a specialization, right?
Yes. Uh, the main reason why I chose art and sports because I love sports, especially
Yeah.
because in the nowadays also I used to play like anything. I mean, I used to play volleyball, kabaddi, gymnastics. So moreover, my interest in gymnastics. So
Hmm.
as per sports, my mental is connected to sports only. And moreover, I
Wow.
can give the better results in sports because within short term, we can give the magic results. But in
Yeah.
other conditions, I may not give that magic results within short 1 minute, 2 minutes.
Fine.
Then I thought that as ortho and sports is the right for me. Then I choose ortho and sports.
Okay. That's great. And right now, as you were talking about gymnastics, I have a small question. This is a personal question from my end. Uh, Even at the age of 30 or 40, is it possible for someone to start gymnastics?
Yes,
Okay.
anybody can start gymnastics.
Okay. So even
In
at
the
the
right
late age,
training,
start
right,
gymnastics.
yes, right training is if provided right training, we can practice gymnastics.
Okay, fine. Because like always I've seen gymnastics is something I loved about, but I never knew like because our place is a very small town, like you don't have these facilities. In terms
Okay.
of schools, what they think, but separately because it's a small town and majorly depends on agriculture and tourism.
Yes, yes.
So yeah, so for everything like we have to go beyond, not nearby. So that's what I was a bit confused because I don't know how much gymnastics have been penetrated in India, but I see this in abroad. But do you have any thought process about it? Why gymnastics is not that famous in India? It's a
I
really
don't think
amazing one, gymnastic, because it will give you a. I've seen like the connection what the gymnasts have between their mind and body is something great.
yes.
But I feel it like this one thing is missing even in schools. Only few schools have gymnastic as a sport. Not like every school has that. Volleyball, basketball, kabaddi, kho all this, even cricket, hockey, these things are there. But gymnastic is
But
not that popular.
okay. Even see, even I don't know that I'm doing a gymnastics, but later I realized that it's a gymnastics because I used to jump anything. I mean, jumping from the walls, hanging on the walls. So a lot of act I used to do. Then I realized that you are doing something gymnastics. My Pizza told me that, Arey, you are doing something, it's a gymnastic related. Then he encouraged me to do some gymnastic related activities. So in that way, I practiced.
Okay, fine, fine, fine. Yeah, as a kid, like we used to do like climbing the trees and all those things we will be doing, jumping. But after some days, we feel it like, no, 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 this is not the right way. And we take something easier choices. Yeah, and thank you so much. And I've seen you put a lot of addition and not just physiotherapy alone. Uh, um, yeah, and before talking about physiotherapy, if you want to say physiotherapy in a very layman term, if you want to explain anyone, even 7-year-old can say what is physiotherapy. Is there any term you use, or is there anything you say to make them understand what is physiotherapy?
Okay. physiotherapy for in a so like I'll explain to the layman or any person.
Yeah.
Physiotherapy means treating the person in physical manner or without any medicine, using physical skills and some modality. We are curing the disease by
Hmm.
combination of all these like electric modalities and manual therapy skills and mainly exercise therapy,
Hmm.
curing the knee pain.
Yeah. Fine.
So this
So
is
this is what
this is
you mentioned as physiotherapy. Yeah, thank you so much. And I see you blend a lot of, because I follow your status regularly. So I see like you blend a lot of yoga and fitness along with
yes,
physiotherapy, right? So like how this combination.
right. Fine. So what I used to practice in my clinic, because I
Hmm.
did many courses, like I did yoga, I did some other body weight training, some other courses of manipulation.
Hmm.
But what I realized is that physiotherapy exercise may not help you sometimes because
Hmm.
patients come from different backgrounds. Some people religious, so they want if I add something yoga related combination, then they feel that there is something it's a they will connect with yoga instead
Hmm.
of this because if I tell in the way of yoga, they think it's connecting them. In that way, it's helping them to yes, it curing their pain. At the same time, it's connecting to their mind also.
Hmm.
In that way, yoga is helping.
Fine. And fitness is mostly when it comes to youngster, the more they get connected with the fitness, or like even all the age group can get connected with fitness.
Fitness, see, everyone can connect provided with proper guidance.
Yeah.
So I encourage every my patients to participate in fitness because initially most of the clients with a pain, but later I will put them into the exercise. Then I will make them understand that fitness role. Then after few sessions, they will think that yes, it's a giving result. So through fitness also, you will get the better result. So even 50, 60 also they are taking the fitness.
Okay. So as we are talking about a lot of fitness, because there is a lot of hype in the market regarding fitness, because the weight loss and all these things
Yes,
are going, like Cult Fit and Healthify Me. There are a lot more platforms, like if you go and see in social media. What is the difference between a physiotherapist providing a fitness session to the patient and a normal fitness trainer providing a session to a client? What is the
okay,
difference?
right. See, regarding physiotherapy and fitness, there are a lot of differences there. See,
Hmm.
in fitness, what they will think that, I mean, fitness aspect, they will not assess in deeper way. I mean, they will assess in the external manner, like they will assess strength, how much strength is there, but they will
Hmm.
not combine with other morbidities like diabetes, hypertension. They will not go into the deep level. The
Hmm.
fitness will think about only strength manner. They will do according to their strength manner. But in physiotherapy, we will assess everything from their history and their background of how much uh, medical history, like morbidities, like obesity, diabetes, hypertension. We are connecting everything, and we will assess everything. I mean, their power, muscle, and range of motion. We will assess everything. So there's a lot of differences there, physiotherapy and fitness.
Yeah.
Even fitness is part of physiotherapy. I'm not able. Sorry, I'm not able to your voice.
Sorry, without knowing I'm muted. No, according to the conversation, whatever happened right now. So, is it okay to say that a patient who come for a clinical therapy, that is like pain management or like
Hmm.
improvement in the functional aspects, then going through physiotherapy, so going through fitness session with the physiotherapy is a great choice. Normally people who go for gymming as an healthy individual without these morbidities and just to work on their strength, is it easy for them to go there? Is
No,
that the
no.
sense?
Okay. See, what will happen? See, even most of my clients, when they have,
Yeah.
yeah, you tell me.
Sorry. You can continue. Then I'll ask.
Okay. Uh, See, most of clients, what will they do? Generally, when they have pain, especially youngers. So those who are in between 30 to
Mm,
40, what they will think that whenever they when they got pain, they visit gym because they think that it's a related muscle related problem. Then they do some
mm,
exercise in the gym. Again, pain aggravates. Then they will come back to the physiotherapy because their pain is not treated because of movement. Again, pain is
mm,
doubled. Then they approach physiotherapy. Okay,
mm,
but this is not wrong approach. First, they seek physiotherapy so that physiotherapist will tell you. So, what is the exact problem? Whether it is a
mm.
movement, muscle related problem, or bone related problem, or nerve related problem. It's not only movement related problem. So, we will physiotherapy will assess everything in broader way. So that they will guide you. Which are the excel help them in long term
Mm.
aspect before going to the gym, but first they should approach physiotherapy first. That's a better.
Fine. Great. So you say that like most of the gym when they are, as at least they should have one consultation with the physiotherapist before going and working on their fitness journey.
Yes.
Yeah, and people who are already having a history of physiotherapy conditions or a neurological conditions or some other physiological condition, it is better to have the clinically getting all right by physiotherapy session then doing non-clinical rehab, that is like fitness training. If they do with the physiotherapist whom they train, they may
Yes.
get the better results as a long-term solution.
Because physiotherapy, what we will diagnose it first. Because the diagnosis
Yeah.
most diagnosis part is missing in other areas. But in physiotherapy, we will make the diagnosis. If we will find the diagnosis, the
Fine.
solution is easy. So, but diagnosis is most easy. I mean, difficult part.
Yeah, as
So,
physiotherapists,
physiotherapy,
like they have a medical knowledge, so it is
uh,
easy for them to provide a precision solution to the patient. For physical trainers or like fitness trainers, they don't have the prior medical knowledge for them to um, say what is the problem before providing the solution.
right? Okay. Yes.
Yeah, fine. Thank you so much. Thank you so much for telling that because the diagnosis part is major part which plays in because if the diagnosis is wrong, then the therapy might be completely it may complicate or because sometimes the very important part because I thought of asking some other question, but this is something interesting, so I want to ask also because people always think exercise, yeah, exercise only, no, lifting the hand, lifting the things. What is the big deal about doing exercise? But they don't understand exercise also can create because people think exercise is not having side effects, but I strongly believe that the more side effects if you do a wrong exercise.
Yes.
What is your point?
Uh, See, actually, exercise is science. Most of the people don't know about this science. They're thinking that so just lifting the legs, lifting the arms. But exercise is science. If you do in a scientific way, we will get the better result. There is no medicine.
Hmm.
Exercise is only medicine. If you do in a scientific way, you will get many results, better results with the exercise. But
Hmm.
nobody tells that exercise is medicine because nobody give importance to the exercise because it's a free. Okay, there is no cost involved in it, and no, I mean, no other person will get the profit from the exercise. Only patients will get the profit. So that's why nobody come forward tell that you do the exercise because there is no, you will not get profit from the exercise. Only you, when you do, you will get the profit.
Hmm. No, but the thing is, sometimes we always think something complicated will give us solution. No, but when it's complicated, it's very difficult for us to be consistent in that thing.
Yes.
Because
Uh,
example, people always want surgery, okay, but when you go to the surgery, surgery alone will not help you to cure. Surgery will help you to fix.
yes. Yes.
But
That's
again, like you have to go through the rehab for you to get the movements back, functions back.
yes. Uh, See what most of the people think that surgery cures everything. No, surgery will not cure everything. Okay. surgery helps you to do something. I mean, 50%. But the 50% comes after the surgery. I mean, physiotherapy or rehab role. Then only you will get the full results with the surgery. Alone surgery will not help you. I see lot of patients, those who going not only knee surgery or any surgery, for every surgery physiotherapy must. If you get the
Yeah.
proper result, the physiotherapy is a must following the surgery. Okay. See,
Yeah.
the purpose of surgery is to make you to do normal activities, not to sit, not to walk simply. But the purpose of surgery is to make you like a run or to do any activity. That is the purpose of surgery. Okay.
Yeah.
When you do proper rehab, then you will do everything. If you don't do rehab, then you sit in like a chair only.
Correct, exactly. Because I see, because me also being in the same industry, like I get patients at times saying that they can't walk because they have a pain, and then after the surgery they say like I can't walk because I've done a surgery.
Okay.
Sometimes I feel like, oh God, really? Because they did the surgery because they could walk better, but they say that I've gone through the surgery, so I can't walk right now.
Yeah. Yes. So everyone thinks
Have you
that,
ever come?
yeah, yes, yes. Many patients think the same way. Because of surgery, I should not do this activity. Because of surgery, I should not stop this activity. If I tell this activity before surgery, people will not listen. So during the physiotherapy, what they will do, they will do everything. If I tell you stop this, they will not listen. But after surgery, they will listen. So that is the mindset of people.
Yeah. No, it's not only mindset, because sometimes no, they need some reason not to do only.
Sometimes awareness, yes, lack of awareness also sometimes.
Yeah. So sometimes it's like they don't want to walk. Uh, few people, no, they don't want to work. So like I had patients, because a few times it's more than working on their physical, because I see you work a lot on mind body synergy, like where mind and body connecting. Because this is also one of the question, I'm taking it from my example. I had a patient, elderly geriatric, like 70 plus years, and they had all the attender. She had a separate nurse at home, like all family members. It's a very well-to-do family, okay? Super well-to-do family. And the patients ask me, Sandhya, why should I walk? I've been walking all 70 years. Right now, I want to rest. Why don't these people bring it to my bed? Why they ask me to do all these things and ask me to walk?
Okay. Hmm.
The thing is, like, I have people working at home, no? Then why should I do all these things? Why should I walk in the first place?
Hmm.
So it is not that they can't. They ask this question. I have 10 members to do work for me. Then
Hmm.
why should I get up?
Okay. Hmm.
So have you ever handled cases like this as
Uh, no, but people tell me that. So when I have many people, so why should do all these activities? Yes, even I saw few patients.
Hmm. No, that time's like, what, where will you work? Where will you work? What would you do? Because
Yes,
here, body part
uh,
can be done easily. I know that. It's not
one
about
part.
body, because we are
Hmm.
very great in
Yes,
handling body.
yes. Uh,
Yeah, you have to do with the mind.
yes. Few patients the same attitude with the same mindset. Like we have everything. So why should do? So their mind is trained to specific conductor because their environment, their surrounding, or other circumstances made them
Hmm.
to do activities like this. Uh,
Hmm.
like for example, my patients only. Most of the patients they will think that we are doing everything using machinery. So why don't we use our body and mental also? When we have everything, so why? So in that way also patients are there. We have
Hmm.
robotics. So everything is coming. Then why they are not taking mind also now. Even physical also they are not taking. So everything is
Through
taking
AI,
with.
right now, people are not thinking.
Uh, but particularly mind is most important when it comes to especially mind related. Because I will tell you, because of when you are not trained to the mind, so our mind is attributed to the one particular system. Because we are not training, when we are not giving proper training to the mind, our mind become will like a uh, what we say rust. When iron is kept for
Not used.
something, then it will become rust. In the same way, when you are not training to the mind, so the mind goes to the rust. Then the degeneration or some other problem related with comes in. But when we should take the role of mind also. Mindset is the most important. Then physical training.
Hmm.
So
Yeah,
we should
because I, yeah, yeah, you complete. Then I'll be
uh,
asking the next.
because patients comes with a different problems with a different mindsets.
Yeah,
Some people thinks in different way. So why should we do exercise? Why should we do running? So when we do everything, why should we do apart from these activities? Every mind is different. So when we are
yeah,
dealing with these patients, it's difficult to understand, because convincing, especially convincing uh, related to their problem, is a tough question. Then uh, related, what can I say? For example, it's all about mind matters. Right? Everything
yeah.
relates from speaking to the convincing to the it's come mind matters.
Yeah, exactly. Because why I ask this question is even this patient comes to me like, yeah, I know what she said is exactly right because everyone is there to serve her, so that's not a problem. But only one question I asked her, telling that like, okay, rest of the things okay, but think like when no one is there, you have to go to washroom. Suddenly, due to some reason, no one is there available at all. But you want to go to your washroom at least for that aspect.
But,
If you don't want to be independent completely is okay, but at least from your bed to walk 10 step further and using your washroom independently, for that sake, are you ready to do it? Then they were ready because rest of the thing is okay, you have everyone, but there are few basic necessities where
mm,
if we are independent we feel so good about it. So at only for that reasons is it okay for you to work. Then she was ready because for everyone this is the question. Okay, first give me the reason. What is the necessity for me to do all these things?
okay.
Yeah, so that is there because as you were talking about the conveyancing, because most of the therapists also ask me, ma'am, everything
Mm,
is okay, ma'am. When we provide, they give results, but how to make them understand that we can give the results? So the question will come.
okay,
Lot
okay.
of
Yes.
therapists talk to me, they will say, ma'am, I know, ma'am, if I do this, I'll give 100% result to my patient. I don't have any doubt in that. But making
Okay.
the patient believe is the problem what I face. How can I
No.
make them believe that I'm the right person taking therapy from me? Like you will get all right. So
Okay.
these questions
Question.
are something that was asked to me. So that's why I thought because you handle a lot of because with 18 years of experience, I can see like I can just think about scenarios and case studies like how much you have gone through. It's not an easy journey.
Yes.
Each one will come up with different mind block. Will put you
Mm,
in a situation like, oh God, I've never thought of this perspective. What should I do next?
yes.
Interesting case like that where it was very tough and very difficult, but it the patient is not that stubborn. There was some block when you handled it, then they got amazing results, something like that.
Yes. Yes.
Can you share one or two story of your patient like that where it was very tough question for you to answer or to make them understand and then later it was an easy journey for you?
In the early stage, I have to face the same problem. Like, uh, especially the paralytic patients. So in our area,
Hmm.
people believe in that, like tree medicines, something, chatla mandulu, tree medicine. They will drink some juice. It's a paralytic condition. So I used to treat almost. I treated him around 6 months. Guillain-Barré syndrome. Initially, this thought that it's a some old karma or some other. They will not listen. They are not listening. They are listening. That's Ayurveda. It's not Ayurvedic. Tree medicine or some devilies came inside. So they are
All the
super superstitious
superstition,
beliefs.
superstition, and all these astrologers.
Yes. So they used to believe in the same category, but
Mm,
I'm giving a treatment. No result is coming because of no result, they are believing in other areas. But after 2 to 3 months, then result is started. Then then they are thinking that yes, physiotherapy is working. Then they removed all these tree medicine, the devil superstitious things, everything removed. So after 6 months, he is able to drive on his own, and he dropped me at central. I mean, at my PG center after completion of his physiotherapy course. So for them, I made him to understand is a very difficult. I face very difficult. Then after that, okay, I
mm,
able to understand everyone. I mean, convincing. So I'm making to about the importance of physiotherapy.
mm. Correct. Because sometimes it's because always like orthopedic conditions are much more easier to give results, but neurological conditions are not that easy. I can
Very
completely
time
understand. A lot
taking,
of patience is
loss of patience is another.
yeah, yeah, a lot. See, if patient cooperates, then things are much more easier because it's always two-way approach because it's not always
Yes,
the therapist, it's always
patient approach is
patient.
most. Only you can give the result. Otherwise, it's impossible.
Yeah, yeah. No, but sometimes how do you handle because there's all the questions like make therapist because you're being senior most and being there in the field for more than 18 years. So I'm asking from the aspect of because at present I get this questions. Okay, so I get this question quite often. So that's why I'm putting this question. When patient comes and like when they want to take a therapy, sometimes they don't know what it is. No, if they ask you questions
Okay.
um, yeah, so everything is okay, but do I get 100% result? Because always patients will come. Already, I've tried. I went to doctor in this city,
Yeah.
that city. Nothing have worked. And right now, how to bring trust in them to start the physiotherapy session?
Yes. Even I faced the same problem initially, almost 8 years back. So nobody is willing to do physiotherapy. So convincing
Hmm.
them physiotherapy and an understanding, making understanding about physiotherapy is difficult initial days. Even now also, I'm facing the same issue now also. So what I will tell them that, so I explain everything. What is a physiotherapy? How it will give results. So then I will tell them that first you try for 1 week. If you get the result, then you continue the physiotherapy. Otherwise, don't come. So in that way, I will convince so that during 1 week, then I will communicate because I will get half an hour time. So during the half an hour, then I will dig into their history. What is their problem? So in
Yeah.
that way, I will communicate with the properly. Then I will make them understand about this physiotherapy. Then they will think that oh, this
Okay.
physiotherapy making helping them. Then they will think that yes, it is working.
Yeah.
If after 4 or 5 sessions, they are seeing the result. So after results, if I tell 1 month also, they are taking the 1 month also because they are seeing the result.
Yeah. Am I audible? Yeah. In between, there was some network glitch. Yeah, there's a network glitch.
Okay.
Yeah, so I understood. You said like you will ask them to try it for a week. After that, like you dig deeper and then they understand and they see the results and they continue. So that is
Yes.
okay. But like most of the time they say like they know it's more of awareness lack or whatever it is. As a physiotherapist, they know it is not a one day game.
Yes.
It's
Yes.
not like a 2020 or a one day. It's like a little bit longer period of time. It's not like a
Okay.
sprint. It's like a marathon. Yeah, it's not a sprint, it's a marathon, if I have to tell it in a sports terminology. But they expect for this instant results, like
Yes.
3 years problem, 5 years problem. They want to get all right in 3 days or 5 days sometimes.
Yes.
And we know. it's not possible. But sometimes, is it okay to tell on the first day, or is it okay to tell later? Like, what do you think about it?
Yeah. See, most of the patients
What will you
come.
do?
Uh, See, patients. Most of the patients come through referrals from other doctors. They will prescribe 5 days IFT, 5 days, some ultrasound they will prescribe. Patients want the same treatment for 5 days. So doctor told me that to take only 5 days. That doctor told me to take only 10 days. Because that doctor don't know about the physiotherapy and the other parts exercise role also. The doctor, in general way, he mentioned that take the physiotherapy, but they want only because the doctor told only 5 days, they want only 7 days. No, I will explain that. The doctor knows only physiotherapy only 1%. He mentioned that take the physiotherapy. Then I will explain about the he will the physiotherapy importance, the chronicity. I mean, your pain comes through for years together. Your central nervous system is already adapted to bring back the result. It takes some time. Some patient listen. Some
Mm.
patient mostly may not listen. They want only 5 days. Even in
Mm.
spite of cancer, they want only 5 days. Then I will tell them if you want continue for few
Mm.
days, better continue because I explain everything. At the end, your wish. But it gives the results when you take the one course, then only give the result. So in that way, I will explain. I'll convince them. But 99% people listen.
Yeah. No, at times, like what kind of approach I use, the same thing. At times, I say, like,
Uh,
yeah, you want that, no? Like, I'll get the consent form signed. I'll say, like, if they want exactly what the doctor said, I'll give you, but if you don't get the result, you're responsible because I said this is not the right way to
no, no, I
treat
will not
it.
do like that.
If you can sign this paper, no, I'll say, if you sign this paper, if you get the result, I'm happy. If you don't get the result, also, it is your responsibility. I will not take the blame. If you're ready to take that, we can go with it. If not, you
Okay.
can go with my plan. So right now, like no one is ready to go through the consent form.
Even
Yeah,
such
because
when
sometimes
yes,
when we don't explain, no,
uh, yes,
no, when we don't, this is to make them realize and understand. I'll write, okay, you want it, will give, but I want you to sign a consent form saying that whatever happens, responsibility yours. Because I'm going to follow whatever doctor tells, but I already said this is the best treatment for you. So already I've given this is the best solution, but you don't want to listen. Me
that's a better best approach. You are taking one
me being
consent.
in the profession for 10 plus years, I've given this much result to so many patients, but you're insisting me to go.
Yes.
Yeah, so you're insisting me to do it. So for your happiness, I'm ready to do it, but I need your consent, telling that you are taking the responsibility for your recovery. Then I'll go
Okay.
it. But anyhow, then I understand because I put them in a place like because I don't want to say no abruptly. So I say like, yeah, I'm okay to give. But first I would approach all my details. This is how going is the best possible or best choice or best option for you. But if you can't go through it, I'm okay to follow your doctor, whatever said. I'm okay. I don't have any problem. But you take responsibility. I don't take responsibility because whatever I do, I take responsibility. This is what you want me to do. So I can't take the responsibility. Then
Okay.
they'll come to me. Then they are okay for my problems and my plan.
So that's a good approach.
Yeah.
You're taking consent.
Yeah. I does most of the time, and sometimes I can't say no to. Do you see home patients also? You go home and see patients.
Yes, I used to do initial days, but after that I have stopped. From last 9 years, I'm not doing. So
Okay,
intentionally, I'm
even
not doing.
I do.
Hmm.
Okay, so intentionally you stop, but sometimes patients wants you to come. What will you do?
No, I will not. See,
How will you make them come to? Now, how will you
that's
make them come to your clinic by putting it in a way?
right. That's the right question because even my junior teachers will ask the same question because many patients from different cities also, even different districts also. Uh, First, when they are able to move, they should come to my clinic
Hmm.
because you
Hmm.
are able to move. When you come to the clinic, the atmosphere is different. the
Mm.
willingness to make you to come here, it's made you that mentally you're coming for the good thing. When I come to the home
Mm.
visit, you will think that the doctor, you will take it is in another way. So there is no initiation
Mm.
when I come to your
Mm.
home. But when you come to the clinic, so there is a positive vibration started already. So that makes you
Mm.
to positive and healing in better way. So I explain everything.
Mm.
So the importance of coming to the clinic, where you will get all the modalities, and we have lot of space to do exercise, and seeing the patients also you will get positive. So atmosphere is
Mm.
different and come within the what in the home what will pain. We will look this as depend upon the circumstances we will do the treatment. But in the clinic, so as per your needs, so we will do so many activities. So in that way, patient will convince with my approach.
Okay, fine. So example, right now, is it okay for you to do a role play? Like I call from Hyderabad and I ask, "Hi, Dr. Srinivas. Like I've been diagnosed frozen shoulder. Is it possible for you to come home and provide the therapy?"
Okay. Then,
So what will be?
yes, I will answer that.
Hmm.
Whoever is the patient, first, what is the root cause for your frozen shoulder? Is whether frozen shoulder
Hmm.
or not, we don't know. But you are telling it's a frozen shoulder. So you are confirming your condition diagnosis, your only. But as per my assessment, maybe the condition might go into another way. Maybe some rotator
Oh.
cuff injury. We don't know. So after assessment, it may not be frozen shoulder. It may go into the another condition. So if you come to the
Yeah.
clinic, so in better way I can assess you. Whether if it is frozen shoulder, for example, if it is frozen shoulder, in
Hmm.
frozen shoulder, we can't treat in the home because in clinic we have different exercise modalities. Using the exercise modalities, we can do lot of exercise activities. In the home,
Hmm.
we cannot do that those activities. So I explain the importance of this exercise role, even if it is frozen shoulder also. So I will make them understand the importance of exercise role. So mostly
Hmm.
people listen to my words.
Okay, fine. Got it. Because when you explain them and things like that, yeah, that is one way approach. Like, yeah, so lot time, like I approach it in a different way where I say like, yes, I'm okay, but the thing is, my cost coming home now will change the role. So your patient, yeah, if I have to come to your home, my 1 hour cost to come home is 10K.
Okay. Mm-hmm.
Yeah. But the same thing, if you come to my clinic, the cost is 1K. And we have all the facilities available here. So
Mm-hmm.
right now it is your choice. Because if I come to your home, I can do it conventionally, but the charge is higher because I have to travel and come and travel allowance. And coming and going, like I for me, some time goes for you to come and go. So I have to pay for that. Yeah. I'm going to charge for a half a day cost. No, in between I stopped because there was a network lag. Yeah,
Okay.
so I'll be charging for a half a day cost, which is around like 10K. Now you decide and you tell me if you want to me to come home by paying 10K, I don't have any problem.
Okay. Mm.
Generally 10K, they will not say yes, I know that. So that
Really.
I make them come.
Okay. That's a nice approach.
Yeah. Because when it comes to home, home visit charges, they'll say, no, ma'am, I'll come to the clinic. Am I
Yes.
audible?
Yes, madam. Yes. Yes. Yes.
Yeah. Yeah. No, that is what. As soon as I say my home visit charges are very high, then automatically they'll come to the clinic only. They'll not come. They'll not
Okay.
ask me to come home.
Okay. Fine. Fine.
Yeah.
That's a good
Even
approach.
if they
Even.
take a driver and come with a taxi, also the cost will be less only. It will not be too much for the amount what I ask.
Okay.
Yeah, yeah. I say no, but I say it in a different way because each one use because why I said this when we tell there are so many choices. It's not like one way to make them understand because people always think there is a particular method to tell it. There are different methods, no one way method. There are
Okay.
number of methods for us to make them understand, make them realize. And I know like you'll be doing it in a different way for each condition. Yeah,
Yes.
sometimes we help people home visits if it's a completely bedridden case. So if
Yeah,
it's
yes.
completely bedridden, we will not say anything. We will say like bedridden patients we can understand. If they can walk, then no choice. We never go.
Never. Yes.
So we also have a strong policy. Except bedridden, we don't take house visits.
Yes.
We take only if they pay 10K. Two choice. One, it should be bedridden, we go. Or else if they are ready to pay 10K, we go. Other than the two choice, we don't go.
Okay. So right. Good approach that one.
Yeah. And as we already said, you see, and very, very important, yeah, this question I thought of asking. You're a therapist, I've seen, you're not only teach or preach your patients or you make them do it. I see yourself doing everything.
No, before I teach and preach, first I practice myself.
Yes,
Uh,
exactly. I see you practice a lot.
yes. For last
When
15
I
years, uh,
therapist,
so
why
I
is it
believe,
that?
yes, I believe in one principle. Before teaching to any somebody else, first I should experience anything. I believe in the same philosophy. Before explaining to or teaching or preaching to someone, I should experience.
Yeah, sorry.
Okay.
Yeah.
So for anything, what will I do? So first I practice on myself because I will come to know. So
Hmm.
in which problem or when in muscle is facing difficult, so that for me it is easy to explain for other patients because this exercise making difficult because first I'm experiencing everything. So this
Hmm.
position making it difficult. So I can, if I experience, then only I can tell much better.
Hmm.
So in that way, I practice on myself
Yeah.
first. I do practice every day for 1 hour compulsory. Whether it's
Yeah.
rain, cold, or something is there, I don't bother about. First, I work out, then I will start my activities. Even
Wow. No,
sometimes, uh,
no, that is a great approach because I see this is missing in most of the physiotherapists.
okay,
Yeah. And I'm very happy like because I also strongly believe in preach what you practice because it's more than you experiencing it. The confidence when you're telling to the patients is much higher when you practice.
yes, yes.
Yeah.
There is a one proverb is there, some like. So
Hmm.
before cutting the tree, the axe should be sharpened.
Hmm. Correct. You're the axe.
Uh, So if you
Yeah.
want to cut 100 trees, the axe should be sharp. So if we sharp, then only we can treat 100 patients. If we are
Yeah.
only dull, so it's difficult.
Exactly. I love that proverb. I really love that proverb. Physiotherapists or the patients, whomever like seeing this podcast, I want you to take this point because I'm majorly physiotherapist. If you want to see 100 patients, like you should have the energy of helping
Yes,
100 patients. Like you yourself lack the energy, how you can help people. So make
yes,
sure first you be fit enough, you be strong enough, and you be like healthy so that you can give this to all other patients who are coming there.
yes. Even I treat
Yeah.
every day for patients. For
Hmm.
every 40 patients, I do exercise along with them also. So every patient asks me, sir, how you are doing this exercise along with them? So for that, I tell them that even at the night 9 also, I do exercise. Even with one patient also, I do at the night also, I will do exercise along with them also. They will shock how you are doing this all this exercise for every patient. So before I'm teaching to you, I practice in the 4:30. I mean, I practice, then I'm coming to the clinic. So that is
Hmm.
making to do these activities.
Wow, that is amazing. And right now, like, if you have a message to budding physiotherapists,
Okay.
Okay. So right now, like their thought process, their mindset, and their belief is completely different. If you have one message to convey to them, what will be that one message for them to be successful in the career?
Okay. So those who want physiotherapy profession, first they should have one patience, patience and fitness. These two must have every physiotherapist. Why patience means because we see lot of patients with a different mindset. Okay. Sometimes we may not get the result. Our patience in aspects in every manner because physiotherapy is a new profession, convincing, explaining, understanding. It's a new job role. It's not easy to approach. For us, patience is most. The fitness is not only physically, even mentally also. Mentally, mentally we should read the books because we see a lot of patients with a different mindsets in order to cope up because we need to even what we will say uh, we are mentally strong, we can do miracles than physical
Hmm.
also. So
Fine.
those who are coming to the physiotherapy first, they must have patience and fitness mentally and physically. These are
Yeah.
two weapons. I believe in these two principles.
Yeah. Thank you so much. And when you're talking about books, no, I was so happy that you read my book. So thank you so much for that.
I read your
Because like,
book. It's a fantastic book. So every
yeah, yeah.
physio is reading that book in my clinic.
Thank you so much. Because whenever someone say no, like they read my books, like I'll feel like super happy. Okay, people are reading my book, so I'm happy. So because
Even
this,
patients read your book. Even patients also read your book. So patients think, oh, physios also writing book also.
okay, they're asking that.
They are asking.
Yeah. No, I was super happy. But each time when physiotherapists call sometimes and say, "Ma'am, I read your book," I feel super happy. But and I say like, "Okay, is it helping you?" Then I said, "Yeah, ma'am, learn a lot and things like that." I felt okay. See, when readers say that the book is good, that is what makes an author feel happy. So it's not about how many readers I've read. If at least change one physiotherapist's life, I'd be happy. That is the intention I kept and wrote that book because if I got those learnings very earlier, because I have paid for those learnings, whatever I written in that book, only people around me know, like for those learnings, how much I've spent money to get that thing and put it as in the paper. So um, if people can read it and get benefited out of it, I'm very happy that they're coming to your clinic and practicing and reading and they're starting their own clinic. That made me so happy.
Okay, okay.
Yeah. So that means like if this is helping to make more entrepreneurs, like more physiopreneurs, like that means like my exactly what I was thinking to do through the book, it is happening. So I'm happy with that. And I have few questions, like it is fast questions. We'll complete it sooner because it's going to be
Okay.
an hour. And I know like you have a lot of patients who are waiting for you, so I don't want you to keep you waited. One book or t-shirt that deeply influenced your practice. Your practice, if there is any one book or a mentor, you can tell us.
One book. Yes, one book. Simplify. Simply.
Simplify.
Uh, it's a autobiography of Gopinath.
Fine.
That helps me to practice or anything. I mean, so practicing or values. So that would help me a lot.
Fine. Thank you
Simplify.
so much. Like people who are watching the podcast, note down this book. Even I'm going to read this book. I'll read it and I'll tell you the review because I'm a reader. I'm a big fan of book reading. So like I'll make sure like I'll read it and come back. And if if there is any fun element to know about you other than the physiotherapist part, what would you say about you?
Fun element for physiotherapy. Yes, uh, I dance. Uh,
Okay,
I do
then we wish
dance.
to have video with the dance.
Okay. I do dance. I do trick a lot. Uh, I write so much. I mean, I write. I love to write. I like to write many
Okay, then
things.
I think so soon we can expect a book from you, as you love writing.
Myself, I write.
Okay. No, still you can write.
Still write,
So
but I'm with my own writings.
yeah, we'll be happy to read that writing as well. Yeah, and as a founder, how do you manage your physiotherapy clinician? You're also a clinician and also you run a business.
Yes.
Both are different role.
Sorry, I didn't get your question.
You're also a clinician where you see patient and also you run a business that is your Swecha Physiotherapy Center.
Yes, yes, I do
How do
both.
you manage? How do you manage both? How do you manage both?
Uh, it's difficult to answer. Managing means it has happened.
Yeah, because
Maybe because of books reading or my mind is mental. I mean, what? Maybe books is helping me to balance these activities. I don't know in which way, but it's making balance.
okay, fine. So you say like for you to manage this both together, your books are helping. Reading books are helping,
Yes.
and I can see a lot of books in the back. It looks so great.
Books
Like
and
even
fitness.
I have. Pardon?
Books and fitness.
Yeah, books and fitness. Now I understood like how you can manage books and fitness. That's one of guys like if you want to manage your business and your clinical practice, I think so like books and fitness will help you a lot. So
Right,
make
right,
use
correct.
of. Yeah,
Yes.
and thank you so much. And thank you so much. As soon I called, you were happy to give your date and time. And I'm really, really grateful because um, uh,
Okay.
people who are watching the podcast, uh, I don't know how many people know Dr. Srinivas. Like, he's running a physiotherapy center in Hyderabad. The way he is work, what he does is literally amazing because I regularly follow him and see what he is doing to the patient and also what he is doing for himself. So only few I have seen who are literally like you can say like who are deeply rooted into that. Yeah. Sake of doing a business is different and doing it soulfully is different. That is what I've seen in Dr. Srinivas. So that's the reason I want to interview him personally to say that it is not difficult to run a business or to be a clinician. Like if you put your mind, heart, and soul together, you can do anything. It's possible. And a living example, you have Dr. Srinivas here. Mm, coming from a, as you already mentioned, like he started his business with 10,000 rupees. And right now, how many square feet your physiotherapy clinic is at present? What is this?
1,000. 1,000.
Is your own place or is a rented one?
Rented one only.
Yeah, rented one only. Initially, you
Right.
started with the size of the room.
Initially, I started with 400 SFT.
Yeah, 400 he started with. Right now, we have increased and he started through bench. There are so many failures he have faced and understood and learned from it. And very important part, what I love about Dr. Srinivas, he never quit. Always he want not to work. He want to be have his own freedom. Swecha represent that mainly. And at present, I think so. Like the your life experience taught you more than your books, and right now, like book also added together with that taking you towards a great journey, if I've understood it right. Yeah. So I had really amazing conversation with you. I literally had an amazing conversation. And thank you for sharing each and everything. And if you have anything to
Yes.
share to the audience who are watching, we'll be happy
Okay.
to hear that.
Uh, Dr. Sandhya Garu, thank you so much as a gratitude because uh, many people don't know about the physiotherapy and physiotherapists also don't know. So what is the right kind of physiotherapy approach and practice? Maybe your podcast helps them in better way and other people's also. But you are taking good initiative I don't know how I explain, but I tried my level to uh, explain in my own. I'm not good at English, but I'm explained. But she okay with my. She agreed to take my interview, even though my English is not good. But thank you for accepting whatever who am I. So thank you, Dr. Sanjay Garu. Thank you so much. Sure, definitely.
The thing is, yeah, English is just a language, Dr. Srinivas, because whatever you said, people understood it. Because when comments and other things are coming, feedbacks are coming, you will understand. English is a way to communicate. English is a way to talk. People who are speaking English, that doesn't mean that they are something great. If for us, this is not a mother tongue. English is not a mother tongue. So we have
Yes,
different mother tongues in India. Only if you can't speak your mother tongue, you can feel a little bit bad about it. But other than that, you can't speak English fluently. No need to think. Can Americans speak Telugu fluently?
yes, no.
But they don't have any problem with that. They don't feel anything low or big or something like that. Nothing. Okay. So same way. Okay. So you're very great in Telugu. I know that. Okay. So that we have to be very proud in the language what we can speak. The rest of the other language, if we know itself, that's a big deal. So you know English, you know Hindi, and you know Telugu. You go to North, not North. You go to Western countries. They know only English. Other than English, they don't know anything.
Okay.
So we know three languages. We don't know
Yes,
one
yes.
languages. We know three languages. Actually, I can speak Hindi. I can speak Tamil. I can speak Malayalam. I can speak English. I can understand Telugu. Okay, I can
Super.
speak Kannada. So that's what
Hmm.
I'm saying. Like when we can speak more.
Yes.
So all are languages. That's it. So you should be so proud that you know Telugu, you know Hindi, and you know English. So you know three languages. So be proud about you can speak three languages.
Approach.
Yeah. So I'm super proud of you. I'm super proud of all the physiotherapists in India because uh, never ever think you can't speak English because English is one of the language. English is
Okay.
not everything. Yeah, because see, you don't know English, but do you still make money?
Yes. Yes, I'm making.
Yeah. Yeah, you make a lot. So it's not about English, okay? So it's about in your place, if you know Telugu only, you can make money. Knowing English is not going to create much difference.
Yes, yes.
Yeah. So I want to because a lot of people think that if we speak English, we can do something great. No, nothing. If you
Okay.
speak, great. If you can understand, if you can manage, that is super great. Never
Okay.
ever think bad about you can't speak English. And literally, you did great. Literally, you did great in English. I'm literally saying you did amazing the way you explained in English.
Thank you.
Yeah. And thank you so much for coming because sometimes we feel it like we are in a small place. A lot of people don't know because but the experience and the learning, the books, what you're doing in real life, that is very, very important for the other people who are listening here.
Okay.
Yeah. And thank you so much for sharing.
Thank you. Thank you so much.
Don't share their secrets. I'm happy that you shared all your secrets in terms of consultation and everything. So thank you so much for that.
Okay.
Yeah. Thank you so much.
Thank you.
Yeah. Yeah. I'll give the end. And thank you, audience, for listening to the podcast, The Movement with Dr. Sandhya Ravi. And today we had Dr. Srinivas as a chief guest from Hyderabad. I hope like you enjoyed the session. Like we had a lot of insights and lot of golden nuggets, you can say, and bellbound moments. Because the way conversation and it was so simple, and I think so most of the people can understand. And if you really like this podcast, and if you have any doubts to ask to Dr. Srinivas or to ask me, please make sure you put it in the comment or like you can DM directly to us through whatever platform you're watching this podcast. And thank you so much for joining us. And you're signing off the moment with Dr. Sandhya Ravi.